Prior to beginning the activity, please be sure to review the faculty information and disclosure statements, as well as the learning objectives. After listening to the activity, complete the post-test by clicking the Earn Credit link in the episode description. The following presentation is copyrighted by Medscape. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of Medscape.
Hi, welcome to our podcast, Tech Tips and Tools, Enhancing Your COVID-19 Response. I'm Dr. Hansa Bhargava, Chief Medical Officer for Medscape Education. Today, we continue our discussion of PPE. Our frontline healthcare workers are fighting the COVID battlefront, and it seems that it's going to be a while before we're done with it. PPE has been deficient across the board, and the question is, how can we keep the supply going? I'm excited today to have Dr. Megan Rainey with us, one of the co-founders of a nonprofit organization to get more PPE in the hands of the people who need it. Dr. Rainey, thank you so much for being here and talking about this. And I'd love for you to just let us know a couple of lines about yourself and what you're doing in the PPE space.
Thank you, Hansa, for having me on. It's a true joy to be here today. So I am a practicing emergency physician. I'm at Brown University in Providence, Rhode Island. I also do public health research here and run our Center for Digital Health. Within the PPE space, this is not something I was involved in 3 or 4 months ago. Like most of us in medicine, we really didn't think about where our protective equipment came from. But in late February and early March, as COVID-19 started to dominate the discussion on the airwaves, but also started to fill my and others' emergency departments, the lack of protective equipment became all too apparent. And I tend to not sit by the sidelines and bemoan a problem. I try to create fixes. And so an ad hoc group of physicians and nurses and software developers joined together over the first few weeks of March to create this organization, Get Us PPE, getusppe.org, which is really focused on getting donated protective equipment, N95s, but also surgical masks, gowns, gloves, hand sanitizer, name the kind of PPE, we're interested in it. So getting that donated PPE into the hands of healthcare workers that need it.
Wow, that's fantastic. And thank you for all your great work in that. I think it's so important for healthcare workers to be advocates to get something done rather than sit on the sidelines, like you said. So there are a lot of pop-up companies that I'm seeing right now saying that they have PPE. Some of them are saying that it's directly from other countries such as China, that they might be K95 or, other certified. How does N95 specifically differ from all of these other entities, and should we care?
Yeah, so we should care. There is a big difference between N95s and all those other types. The really well-made KN95s may be the same as N95s in terms of their ability to filter out those little viral particles that can make us sick from COVID-19. However, unfortunately, the supply chain has been filled by black market folks and people making counterfeit goods. And so it's really tough right now to verify that the KN95s that we're getting from overseas are actually good enough at filtering out those little viral particles to keep us safe.
So Megan, thank you for explaining that. That's really important to know. Was it because of the emergency use authorization that we had with PPE that this kind of happened? And what has happened to the emergency use authorization now?
Yeah, so I would actually say that the problem that we're having is more because we were delayed in getting going in preparing for this pandemic. My own hospital system way back in December and January started trying to create some sort of stockpile of masks, both surgical masks and N95s, knowing that this was coming, but production did not ramp up in our country ahead of time. And so, even the best laid supplies got decimated in those early weeks because everyone across the country was trying to buy new supplies. We were using them so much faster than the supply could be brought in. And that created the space where counterfeit manufacturers swooped in, saw a chance for profiteering and or for distributing, again, counterfeit goods. The emergency use authorizations, one good thing that did happen in early March is that the government said that we could use NIOSH certified N95s in addition to FDA certified N95s, and the difference there is in like the sterility of the manufacturing plants. It's really kind of a technical detail, but we haven't really fully ramped up production across the United States yet. So we are still facing shortages in supply, and I think the rise in counterfeits is really due just to that lack of supply. It's supply and demand, and it gives some people a space to do bad things and charge lots of money.
And so in terms of the supply chain, that's a really important topic. If there isn't enough supply in the United States right now because we haven't ramped up, can we turn to countries outside of our borders to send us those supplies, or would you be concerned about how safe they are and whether they meet requirements?
So traditionally in the United States, we meet a lot of our supply chain needs through protective equipment and other types of medical goods that are produced outside of the United States. And that's largely because they're cheaper. So I don't think there's any inherent problem with getting supplies from other countries, but there are two problems that present themselves in this pandemic situation. The first is we need to make sure that those supplies are high quality, that we're not giving substandard equipment to our healthcare workers. The second problem is recognize this is a global pandemic. And so supplies that may have been available from other countries suddenly aren't, because every other country in the world is competing to buy those as well. So those are two very good arguments for actively trying to ramp up production in the United States and make a commitment to continuing to purchase from those homegrown manufacturers, even when this pandemic is over, because it costs a lot for local factories to retrofit and employ people and get new sources of materials. So I think there is a strong argument for trying to buy locally, but recognizing that it's probably going to cost a little more.
So if we try to ramp it up locally and or in the United States, and I did have a doctor on who's been working on that end from it with private sector relationships, what other issues are in that stream of supply, Megan? For example, some entities have reported that they will call hospitals and the hospitals will say, well, no, we have enough supply, but then you'll see doctors on social media and nurses and other healthcare providers saying, no, we're not getting them. So where is the discrepancy there?
So it is such a complicated system. The supply chain is this it's like a cell, for all of us that are physicians or nurses listening to this, it's this, very delicately balanced homeostasis that has just been completely thrown off in the past 2 months. There are so many elements of the supply chain, from the production of the raw materials, which are really complicated, to the factories themselves, to the distribution networks and the ability to fly this stuff or drive this stuff around in a timely fashion. And then on the hospital level, there's the need to certify it, to make sure that these supplies are real and really will protect the healthcare workers, and then the decisions on the part of the healthcare facilities about where to send that PPE. I don't think there's a physician or nurse or tech in the country who is using masks and gowns the same way that we did in January. We are all reusing those N95s for as long as we can. Many of us now have systems for sterilizing them. None of us were doing that in January, right? So it depends on what your definition of sufficient might be. The other thing that I'll highlight is that it is much easier for large healthcare systems to fill their supply needs because they have more money and they have more ability to create new contracts, we're finding that those contracts need to be really large right now and largely cash-based. Smaller healthcare systems, clinics, and folks in treating vulnerable populations are going to have a lot more difficulty getting adequate supply. But at the end of the day, I think a lot of it also comes down to how you define adequate, and recognizing that we're in this new normal where what would have made us comfortable again back in December or January is just simply not an option for anyone right now.
So Megan, I think you point out something really interesting, and that is that the smaller hospital systems, usually most of the time in probably rural areas, are already in perhaps a difficult position, and now this will cause them to be in a more difficult position because they just don't have the capital. Is that what I'm hearing from you?
Yeah, that's right. This is really endangering our small clinics, our critical access hospitals, and our safety net facilities. And I'll say it's why at Get Us PPE, we've been trying to focus on making sure that donations go to those hospital systems and healthcare facilities that really don't have any other options.
Well, I think that's really important and becomes more of an issue, especially since the rural healthcare system is already often compromised. Is there price gouging happening at all? What would you say to that?
There absolutely is price gouging. I've seen the price of gowns, which are normally well under $1, go up to as much as $20 per isolation
Oh,
gown.
wow.
And it's just simple supply and demand. And I think it raises this bigger question of whether we should be have kind of essential medical equipment operate under the standard economic supply and demand system. Particularly in these sorts of pandemic situations, we really need some kind of centralized purchasing or price stabilization. We need transparency around prices so that desperate hospitals don't get taken advantage of and don't, again, drain their budgets. Very few hospitals are doing well fiscally right now, and the cost of PPE is just prohibitive.
Let me ask you another question. It was interesting. There was an article that came out about the fit of these masks, specifically for women or small faces. And one of our friends actually talked about that, who, I adore, Dr. Salas, about how that actually does not fit her face. And she talked about how the gloves don't fit her hands. Is this an issue in your eyes, in your organization's eyes, in terms of making sure that these fit smaller people and women in particular?
Yeah, it is ironic, right? An isolation gown on me versus on one of my 6'2" colleagues. It's a very, very different thing. There's definitely a greater need for those small N95s, the duckbills, than the classic kind of regular size. And we know that throughout medicine, there has not been as much attention to the specific needs of women physicians and nurses in terms of design, right? So this is certainly something that we're paying attention to. And it's a tough one to fix right now, especially in the midst of the pandemic situation.
It's really interesting because I do remember doing procedures, and even if my glove size was 6.5, it just wasn't as easy to work with it than size 6. I mean, it does really make a difference. So, but I do agree with you that it's very hard, especially right now with the supply issues. So, Megan, I have two other quick questions, and one is, with your work in with PPE, getppe.org, and your own experience, we know that COVID is not anywhere over yet. And we anticipate, or a lot of experts anticipate, that there's going to be a second wave in the fall and winter that may coincide with the flu season. What are your thoughts about having enough supplies for that? Are we prepared? And if not, what can we do?
I am desperately worried, Hansa, about a second wave. I hope that it holds off until the fall and the respiratory virus season. We have increased production locally. I do know of a number of local manufacturers that are trying to retrofit their plants, but the supply is simply not adequate for the healthcare system, much less for all of the other essential workers, folks who are responsible for driving buses, working in meatpacking plants, serving as grocery store clerks, right? All those people need to be protected too. So what can we do? I truly believe that we need a national level response, ideally federal, but if not that, then a consortium of states or a large non-governmental entity to spur production, to guarantee pricing, and to guarantee purchasing. Because again, businesses also have to meet their bottom line, and they're not going to retrofit their plants if they don't know that they can count on supplies being purchased. So we really need a large scale group to come together to spur adequate production of PPE. And I'll say not just PPE, but everything else that's needed too. Testing swabs, hand sanitizer, cleaning wipes, even things like laryngoscope blades and albuterol spacers. There's a lot of equipment that we're going to need when the second wave hits us. And the time to address it is now, not to wait until it starts.
Are there any such consortiums coming together? What can healthcare workers, doctors, nurses, others that are listening to this help you and others do to get this going?
So we at Get Us PPE have created a large coalition of partnerships with a number of other groups that are doing similar work on a local level in order to create a national level database of what need is. We're also working with a group called Project N95, which is working to identify and vet suppliers. So things that individuals can do is to have their hospitals or healthcare systems put their PPE needs into our database at getusppe.org. Work with your medical societies to help us create accurate counts of what's needed, and also to get donations to enable us to pool money to do larger purchases and distribution to those safety net hospitals. And lastly, put pressure on your political representatives. This is not a partisan issue, but this is a place where we really do need our government to step up and help us in the healthcare space to protect our own lives and to protect the lives of our patients.
Great. We have a lot of work to do. Well, Megan, thank you so much for all the work that you're doing in this space. It is so needed. And, I know the audience, and I definitely feel very grateful to you and your colleagues who are doing this work. You've been out there and speaking up about these issues and making a difference. So it is much appreciated. Is there anything else you'd like to add before we come to a close?
No, Hansa, just a big thank you to everyone else out there. I see you and I feel you. I'm on the front lines too, and this is tough. And there's a lot of questions and a lot of still unknown science. And I know that a lot of us feel alone. And so one of our goals at Get Us PPE is to help us all feel a little less alone. But I just want to send a big thank you out to all of my colleagues across the country.
Thank you, Megan. Well, that was Dr. Megan Rainey, and thank you all for joining us for this podcast. I am Dr. Hansa Bhargava. You can follow me at Hansa Bhargava MD on Twitter, and also reach out to Medscape if you have any other questions. Thank you, and we'll see you next time.